Thank you for tuning in to part 2 of our conversation on racism and healthcare in America. And joining us is Dr. Oliver Brooks, the immediate past president of the National Medical Association, Charles Harris, an attorney and partner at the law firm of Mayer Brown LLP in Chicago. We also have Christopher Goins, who is the Chief Equity Officer at Thrive Chicago, who also leads President Obama's My Brother's Keeper initiative in collaboration with the Obama Foundation. There have been a lot of incidences in the Black community that have created stress over the past year, from the Black Lives Matter movement and, George Floyd, Breonna Taylor, and so many more, to the insurrection at the Capitol before the inauguration. The question is, when it comes to our health and well-being, does this matter?
Yeah, I could jump in there with that question, Tom. I think that's a powerful question. And my answer to that question is yes, it does matter. As an educator, and I claim to be a trauma-informed educator, and I wanted to build a school and a community around my students that was aware of the traumatic things that were happening in their lives. And one of the things that we incorporated and used is what we call the ACEs survey. The ACEs survey surveys students around traumatic events that have happened in their life. And if those things are unaddressed, they show up later on in life. And so research has confirmed that trauma in young people's lives show up and impacts their health later on. So it would be unwise for us to not think that what we are experiencing today and all of the racism and the traumatic events that we are witnessing daily is not impacting our own health and could show up in ways later on in life. I'm not a doctor or researcher, but I do know how it shows up in the education, and young people are human beings just like adults are.
I think that, like Chris said, I mean, it definitely takes a toll. I can just thinking about the insurrection since you mentioned that, Tom. I mean, when that happened, I couldn't work for the rest of the day. It's all I thought about, and it was very stressful. And the thing is, and I still had calls with my colleagues, and everybody wanted to continue like nothing happened, and that even made it more difficult and more stressful. I mean, the way we looked at the insurrection as a Black person and seeing the difference in the way we're treated and the two different Americas that we talked about. I mean, it just created a lot of stress for me, just that one event. So when you talk about everything that's happened, I mean, I'm sure it's affected my health. I'm out in ways that I don't even know.
So, Dr. Brooks, as a physician, what can you recommend to people like Charles and me and others on how to release this stress?
I would say step one would be what both Chris and Charles stated. First was recognizing it, not acting as if nothing happened. Number two, it's very important, the statement maybe, I don't even know how it's affected me, but I'm sure it is. That was very powerful, because psychological stress has biological consequences. So do understand that. It was mentioned earlier to talk to those around you. Black men, talk to your brothers. And then I would say that, as indicated, consider getting a therapist. In the African-American community, we tend to utilize psychotherapy or counseling, you want to call it, less so. But I would say ultimately that would be a great benefit, as indicated.
Do we need Black therapists and psychologists to listen to us?
So the studies are not totally clear. Anecdotally and just by instinct, you would feel that you as a black man would do best with a therapist who was a black man, theoretically a black woman. And I would say that I would tend to agree with that. The studies, though, imply that if you have a competent, well-versed therapist, be they black, white, Asian, or Latino, they can help. The total psychology workforce in the United States is somewhere around 5 to 6%. So, and we're again 13%. So there aren't a lot of us to go to, and that's total. So maybe even half of that or less are male. So if you wanted to go to a black psychotherapist or counselor, I think that's fine. But I would impugn and underline and state, don't not get therapy because you can't find a black counselor. So keep looking.
So, Dr. Brooks, you've been practicing medicine for a while, but it must be daunting to see how we progress or regress. So what drives you?
When you become a physician, you take an oath. It's a Hippocratic oath, but in the National Medical Association, we take the oath of Imhotep, the true father of medicine in Egyptian. I am driven because it is my duty. I will also say that I've always wanted to be a healer, and I've always been committed to my people, to the African American community. So with the training, with the knowledge, with the access that I have, it is my duty to ensure that there is improvement in the health of our community. I would also say that there are things that you can and cannot change in medicine. You cannot change your age, you cannot change genetics, you cannot change your family history. But the things that you can change, those are the things that I am dedicated to working on. So that's as the doctors, that's what we do.
So is it true that there are fewer male doctors in our society? Is that true?
It is true.
And why is that?
There are fewer black male doctors in America compared to female doctors. I will also note that there are less black doctors, period, as related to our population. We're 1 in 8 in the United States, but physician-wise, only 1 in 15 are black. That as relates to black male physicians, I think it starts from that cradle to prison. Young black boys are more likely to be suspended. They're less likely to be in a STEM class. They're less likely to be in a magnet school. They're less likely to have the funds. You have to pay to apply to medical school. Now, I'm gonna just give you a little example of what happened to me. When I was in 9th grade, I was in AP biology. There were 20 students. They came in the room and said, we can only have 16. We have to get rid of 4 of you. There were 3 blacks, and they got rid of 2 of the blacks and left me in there and 2 of the whites. So even then, and even in situations as simple as in the classroom, we just don't have the access. And then last, they'll say that it can be a perception. We have been told that we're inferior. We have been told that we are not scientifically oriented. And after a while, when you hear that over and over, some of that you ingrains in you. So we have to get past that also, our black boys.
So what do you think can be done to entice more blacks into the medical field?
So to entice more blacks, and I'll say especially black males, we need to start at the very beginning. We at the NMA are working with a professional organization to have racism as a discussion that all families should have with their children at a young age. Racism is the learned behavior. So if we remove some of the racism out of our society, just by definition, there will be more. We need to mentor these young black individuals, male and female. We have to have a general curiosity about math and science, STEM, science, technology, engineering, and math. We have to have more of that in the community. We get inherent in the community that we are to grow up to be scientists, to be doctors, to be engineers. I think with that type of focus, we can move forward and increase the number of African American physicians, male and female.
Chris, what can be done to improve social determinants of health inequities in our country?
Yeah, I go back to this, what I said earlier. We must empower young people. We must lift up their voice in all that we're doing. And I believe that is the key that will change the social determinants. Those of us that are adults and at this point in our life, we're doing all that we can, but we have much more time. We have less time ahead of us than we do behind us. And so the empowering young people and presenting them with these critical data points, they're going to be our politicians. They're going to be our teachers. They're going to be our leaders in society. And when we empower them, they will be the change that we seek. And I cannot stress that point enough.
It just seems like it's an uphill battle for us as Black men to be healthy. I've been vegan for how old are my children? And I've been exercising like you, Charles, 6 days a week, and I do complete physicals, Dr. Brooks, every year, and no matter what I do, the outcome of my complete physical is always the same. Your blood pressure is too high. Right before the pandemic, I suffered a stroke. Exercising. I was boxing.
Wow.
And stroked out in the ring. So how do we encourage people to do the right thing?
I guess at times there are situations that we just can't do anything about, but generally speaking, that is not true about blood pressure. So we need to have a relationship with our physicians, and a straight up relationship. If we appreciate those that have knowledge and want to get well. I mean, that's something good. Then you're working with me as opposed to I got to figure it all out. So that you had a tough case, Tom, and I'm really sorry to hear that you had the stroke. I will note that you're speaking well, you're looking good. So, obviously there's more than I can see, but you look good, and I'm happy. That to me, that's part of it in the end.
I'm good, but it's slow progress. A lot of work for very little reward goes into recuperating. I'm two rehab sessions a day, but the reward, it's slow. Very, very slow.
First of all, I commend you for being so diligent in your rehab. Rehab is very important. I'm going to go back to something too about your medications. If you truly were taking your medications, I'm going to take your word for it. Although I will say people don't always tell us the full truth when they come to see the doctor, but I can tell you were sincere. A lot of Black men don't take their medicines. I think that there are just concerns. Maybe it'll make them impotent. Maybe since they can't feel the medicine working, that it really isn't doing anything, that they feel that they can get better with diet and exercise and don't really need the medication. There are a lot of reasons. And then I won't say just not being aware of it. I always say, look, if we're in the science, I can take this pill to save my life. 200 years ago, that didn't exist. I can take this pill and save my life. Okay, I'll take it. When? Tell me the time. I'll take it the same time every day. So that's the attitude we need our Black men to have. And the other thing I think we need to get our Black women on is Black women take care of themselves much more than Black men do. And all of us have a mother, and maybe not all alive, but all of us probably have at least one woman in our life who is meaningful, a wife, a girlfriend, a mother, a grandmother, an aunt. Talk to them, just get them to help you be oriented toward your health. You do take full responsibility, but we work together as people. So I would just say to those Black men out there, take your medicine. It's easy. You'd be happy to have it.
Speaking of blood pressure, high blood pressure medicine, would you talk about the myths that that we think? You already spoke about impotence. Is that true? If you take high blood pressure medicine, you stand a chance of being impotent?
No, there's no significant increase in infertility from hypertension, blood pressure medications. Some, they'll call it a water pill. The diuretics will make you go to the bathroom more. So maybe guys don't want to get up at night and go to the bathroom, having to go to the bathroom more frequently. Everything in medicine is benefit risk. Does the benefit outweigh the risk? I just want to be categorical. The benefit outweighs the risk with hypertension medications. I don't know if any of those here on this call have any other myths that they have heard regarding blood pressure medications, but if you have a conception of, I'll call it misperception, but I'll just say a perception that a blood pressure medicine does something that you don't like, what I recommend, again, talk to your doctor. Okay, we'll be straight up with you.
Let me go back to you, Christopher. You've mentioned several times as a principal that you are hiring people to help your students, and I keep hearing about education budget cuts. Where are you finding the money to hire all these people?
That's a great question, and it was based on enrollment. In Illinois, the higher your enrollment at your particular school, the more resources that you have. And so the way that we were able to do it and do these things is that I had to focus on enrollment. And I wanted to make sure that we built a school where parents wanted to send their kids to. And the way that we did that, we targeted the kids. Nowadays, young people have a lot more agency and say-so with their what happens. Parents don't dictate everything for them. And so if you have the student hooked in our recruitment efforts, then you hook the parent. And that's kind of how we did it, and that's how we were able to build some of the things and do some of the things within the school. And they're still doing that. This particular year, they have historical enrollment despite there being a pandemic. The school is almost over. The school is over 700 kids now, and I'm thrilled about that. And one of the things that the principal, my successor principal, has done, he actually hired additional staff to be able to build a health program in the school, not just PE teachers, but he has a team of 5 teachers that are actually teaching physical education as well as health education for Black students. So that's how we do it, Tom.
So Charles, what did you do to release that pressure on January 6th when Trump incited the riots at the Capitol? Because I was, when I finally went to sleep, I woke up in the middle of the night and I went back to Fox News to see what else they'd done. And on the next day, I couldn't function without worrying about that.
Same here. I talked to my friends, talked to my significant other about it. We watch the news, just try to stay abreast of what was going on. But I, like you, didn't sleep much that night. It was very difficult to concentrate on work and to concentrate on anything else other than what I was seeing. And I think what actually helped me kind of release that stress and release that pressure was that I'm the president of a local theater here. It's called Victory Gardens Theater, and the board president. And we had a call where we were talking about some of the issues that white supremacy had created in our theater, and to talk to my colleagues in the theater about kind of analogizing what happened in the Capitol with what I see happen in American theaters and some of the changes we're making in American theater. that really helped me a lot. And that discussion was well received. But I still think about it today, quite honestly, and I'm still upset about some of the answers that I see about kind of why this happened and why there was this difference in the way that these rioters were treated as opposed to how Black people are treated when we have our peaceful protests.
Mental health is considered taboo in our community. How can we get churches to encourage our community to turn to therapy, professional therapy? Or can the churches do that?
Yeah, I would like to say that I do believe that churches can do that. And I think it starts from the pulpit. I think it starts from the shepherd of that flock speaking that message that even, and I had one pastor say this, that like God gave us doctors, God gave us therapists as well. And so, it's Black people and the faith community need to know and understand that is an asset. That is one of the things that that the good Lord has blessed us with. And I think it starts there, the messaging from the pulpit, that, where our leaders in the faith community are speaking to and advocating for proper mental health. And churches are really creative and innovative in some of the things that they do to serve their congregations.
The fact that your church actually has therapy groups is excellent, because that's a step beyond the leader of the flock saying it's okay. That's an action, not a word. We cannot pray away mental health. We cannot pray away the problems we have, especially as African Americans and African American men. So I look at prayer as being an adjuvant, an additive to psychotherapy. And exactly what you said, Chris, we need to hear it from the leader of the flock. I think back to HIV, where we needed the church to come in and demystify theoretically almost homosexuality, but also just HIV. To say, well, look, this is real. Okay, this is what is happening. We have to be strong. We don't address this. This almost goes back to what Tom said earlier about the vaccine. We don't address it, we're gonna die. So get your head out of the sand and understand you may not like it. HIV is here. Deal with it. Mental health in the African American community is here. It's killing us indirectly. Deal with it.
Christopher, as part of President Obama's My Brother's Keeper, what are you doing to encourage young Black people, young Black men especially, on dealing with the pressures of being a young Black man in America?
It's a powerful question, and I cannot stand in this space and not speak to the group that I lead. And MBK, My Brother's Keeper, is a collective impact effort where we bring. I lead a group of 60 individuals representing 90 different organizations, and we come together monthly to talk about and design solutions that will directly impact boys and young men of color. And we've seen incredible outcomes with that. And we are finding that the young people are actually better facilitators than the adults, because they don't come to the space with so many preconceived notions and so many biases that we have as adults.
Charles, what can we do to encourage more Black people like yourself, Black men who are influential, to participate in these conversations? What can we do?
No, that's difficult. I think that we have to encourage the people around us to participate. I mean, otherwise, people are never. It's never going to happen, because just being in the conversation itself might not. I don't think that people really understand the benefits of these type of conversations. So I mean, it's got to be us. It's got to be us in encouraging our brothers to participate. I can't see any other way that it happens.
I want to end this conversation by asking in closing, um, uh, what remarks do you leave with our fellow brothers who are watching this conversation? I'll start with you, Christopher.
What I would leave to fellow brothers watching this conversation is to be the advocates. We have to be the advocates for ourselves. Conversations like this, we cannot expect government. We cannot expect everyone or anyone else to do it for us, except for us. Um, I'm a firm believer in that those that are most impacted by the inequities in our society should be the ones developing the solutions. And I've just kind of dedicated my life to empowering our community, and especially men of color and Black men, um, to own the solutions for our community. And I believe that we can, and I believe that we are the assets. And that's what I would like to lead and share.
I would like to underscore the issue of the blood pressure that we've talked about. Some of this is the genesis of this whole discussion. Tom had a stroke from blood pressure that he worked hard to control but was unable. To know what's going on in your life, you should monitor your own blood pressure. There's a project, Release the Pressure. ReleaseThePressure.org is the website. You sign up to do three things. You take a pledge to monitor your own blood pressure, make a healthcare plan with your doctor, and connect with your squad. These three steps are independent and important. Monitoring your blood pressure, we call it know your numbers. Making a healthcare plan, hypertension or your blood pressure is not the only thing in your health, but it's critical to your health. So you make your overall plan, including monitoring and measuring and controlling your blood pressure. And lastly, bring others along. Primarily, we're looking at this as an African-American female project for Black women, but the Black women can bring men along, Black men can take the pledge. This can save your life. So for those so inclined, and I recommend it for all of the women and the men too, go to releasethepressure.org, take the pledge, and live a longer life with your blood pressure under control.
All right, I want to thank you, gentlemen, for participating in this conversation on racism and healthcare. And I want to thank you for watching, and hope that this conversation inspires you to do something in our community about the disproportionate racism in our community and the healthcare system.
Okay, ladies, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with an upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your 2 measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website